You're listening to Every Day's a Saturday USMC Veteran Podcast.
Now introducing your host of Every Day's a Saturday USMC Veteran, the one-man show, Brian Roof.
Hey, what's going on, friends and fam? Welcome to another great interview, another great day. I'm excited for my next guest. Kind of switching it up a little bit. We're gonna bring someone on here that is very experienced, and I'm sure something that every one of us out there, we enjoy, and that's sleep. I know I love my sleep. I know I hate when I can't get sleep. I hate when those restless nights, or just anxious or whatever, and just have a really rough night of sleep. So I'm excited to have my next guest on and here to talk all about it. He also has a book out there that we're going to be talking about. But here we have is Dr. Barry Krakow. Hey, what's going on, doctor?
Hey, good day, good day.
Welcome to the show. I'm excited to have you on and talk all about yourself. Let's get to kind of know a little bit about you. Give us a little bit about your background, kind of where you grew up, and how you got into sleep studies and being a doctor and all that stuff, and what kind of gravitated you that way.
Well, I'll do my best not to put you to sleep.
That's a good one. From a sleep guy.
So I went to medical school at the University of Maryland in Baltimore and did my residency in internal medicine at the University of New Mexico in Albuquerque. And I spent about 10 years in emergency medicine. But in the late 1980s, which is a long time ago, I got started working with a group of psychiatrists. I'm not a psychiatrist, but with a group of psychiatrists to find a treatment for the problem of chronic nightmares. Because it turns out most people didn't even know nightmares are treatable. They always assumed it would take a medication or psychotherapy. And we developed a technique called Imagery Rehearsal Therapy, IRT, which is now considered the top line non-drug treatment for chronic nightmares, including PTSD nightmares. And from that point forward, I started realizing that I needed to leave emergency medicine and go into a field at the time relatively new and still new called sleep medicine or sleep disorders medicine. And so I've been in that field ever since the early 1990s, pretty much full time in that field, doing research, doing clinical work, doing consulting. And we have learned a tremendous amount of information that led us to the conclusion in the 1990s, this is 20 plus years ago, that if you have a patient, an individual with a mental health problem who's not sleeping well, you can actually improve their mental health by fixing their sleep problem. And once we learned that, all of our research, all of our clinical efforts thereafter was focused on how do you help the sleep of somebody with mental health problems and watch the mental health problems get better. Anxiety, depression, PTSD, not to mention, of course, the insomnia and nightmares. So it's been a very, very satisfying career. The frustrating part is how few people really understand or appreciate this process, which we're going to talk about today. And so many people continue to disrespect sleep. Even in the mental health community, there is a very limited knowledge base about sleep. There's certainly dismissiveness because they think that you can treat all sleep problems with a prescription pad. But we know now that sleep is much more complex. There's many more pathways to treatment. And once somebody gets on that road of discovery to what's really going on with their sleep and starts working on the various treatment solutions, most people are very satisfied with the results.
Nice. Did I lose you? Oh,
Did we lose the connection?
no, maybe for a second now. You're good.
So that's the main background that I think you were asking about.
Right now. So, now how long have you been doing it now?
I've been in sleep full time since 1995, started in sleep medicine in 1988.
Right now, I know with mental health, it seems that like with PTSD and things of that nature, they didn't really acknowledge it more until the probably I would say late 2000s. Once we started having more combat, related incidents come home, and we started seeing, and we started. I feel like mental health started making a way because when I was born, like in the 80s, we didn't have a lot of talk about mental health and stuff like that, right? And attributing anything to, especially with sleep, because I mean a lot of that makes a lot of sense, right? Because they do say, when you're sleeping and stuff like that, that's when your body is most likely to heal itself and things of that nature. And I know that when, people get lack of sleep, they're cranky, uh, very short fused. It seems that way, uh,
Right, right.
just
You're
doing
absolutely correct about the
good at letting us
timing
sleep.
too. You're absolutely correct about the timing as well, because in the mid to late 2000s, we were regularly contacted by military units, veterans administrations. That's when the big explosion of chronic nightmares was noted after Operation Desert Storm and other activity. And that's exactly what you're pointing out about PTSD. So that led to many workshop trainings that I conducted actually all over the world, but primarily at US military bases or VA medical centers. And in fact, in 2013, 2014, we visited 10 different bases on a first sort of a nonstop program because they wanted people to be updated on these more advanced treatments. And the key here wasn't just the recognition that nightmares needed to be treated, but rather there's a whole complexity to it, that nightmares are the tip of an iceberg. These were 3-day intensive trainings. They would have anywhere between 25 or 50 mental health professionals at these trainings. So we trained several hundred mental health providers how to treat sleep problems without drugs. And this led to very eye-opening experiences for these individuals because they were thinking, well, I thought you're supposed to treat the PTSD first, and then the sleep problems are supposed to go away. And we said, well, that's a possibility, but there's not great evidence that that happens on a consistent basis. Whereas there's very consistent evidence now that if you treat sleep problems, particularly nightmares and insomnia, you will actually see improvement in the nightmares and the insomnia, and not to mention the PTSD will decrease, which is pretty remarkable. No drugs, just some very specific cognitive behavioral imagery techniques, some very important instructions people have to learn about the nature of sleep. And when people learn this, they're very excited because they get to take control over their sleep instead of having to yield the control to a sleeping pill.
Now, right now, another thing that's associated with PTSD that it seems to be an interruption with sleep is sleep apnea, right?
Absolutely.
Now, that's another thing I think a lot of people fail to, realize is how much maybe during the nights they've I ran a sleep apnea test before, and I really couldn't get through the test at home because the alarm literally just kept going off every time I would literally knock off. It just kept waking me up.
Wow.
So apparently, I guess I wasn't doing very well. But yeah, I took the machine back. They're like, "Well, it's inconclusive." I was like, "Well, I'm pretty sure I just failed because I mean, I couldn't not.
Mhm.
I mean, as soon as I went to sleep, the thing beeped." So is there any way to treat sleep apnea? I mean, but I know a lot of people do mask and things like that, but is there any
Right.
other methods that are associated with sleep apnea? Is it just something,
Right.
you have to deal with?
There's several treatment methods, but before we get to that, let's bring up why what you're saying is so important. I mean, because it's a critical insight that you're bringing to the table about sleep apnea. In fact, this is a main component of my new book, Life Saving Sleep, which is that when we were doing all this research in the 1990s and in the early 2000s, we were shocked at the number of people who were walked in the door saying, I've got nightmares, I've got insomnia, I've got PTSD. And then with further testing, they had sleep apnea. In fact, we are the leading research group in the world producing data on the astronomical rates of sleep disordered breathing in PTSD patients. We first published on this in 2001 and showed that in a group of crime victims who had sought treatment for the problem of nightmares, insomnia, 90% of them were diagnosed with a sleep breathing condition. That's almost 25 years ago. Since then, we published multiple papers, not only on the diagnosis of sleep apnea and PTSD, but also on the treatment of sleep apnea and PTSD. Nonetheless, keep in mind, many other researchers now all over the world are publishing very similar data, not the same numbers we're getting, which is a more technical issue I can explain, but everybody out there agrees the rate of sleep apnea and PTSD is much higher than we all thought, much higher than we all imagined. And everybody's asking why. And honestly, nobody knows why. Nobody has the clearest answer to explain why there is so much sleep apnea in these patients. And the reason this is so important, I think this is what you were getting at based on your own personal experience. When you have sleep apnea, you are in fact waking up hundreds of times during the night. Your sleep is fragmented. Your sleep is all broken up all night long. You never go into deep sleep. You can barely stay in REM sleep. And what this means is the brain no longer has the capacity to restore itself. Because, like you said, that's what the brain's supposed to do. It's supposed to clean itself, restore itself, regenerate itself. All these things happen while you're sleeping. And it turns out there's this major discovery about 10 years ago by a doctor, I think it's Nettergaard in Rochester, New York, and also over in the Netherlands, that there's a system in the brain called the glymphatic system. Everybody knows what your lymph nodes are, but this is putting the letter G for glial cells, which are brain cells.
Mm.
You put the letter G in front of lymphatic and you get glymphatic. So the glymphatic system is in your brain only. It cleanses out all this toxic material. It was discovered 10 years ago, and you'll never guess when the glymphatic system is working at its highest proficiency. The answer, of course, is sleep, but especially deep sleep.
Like in the
If you
REM?
have, well, not just REM. REM, maybe that data is actually a bit more elusive, but deep delta sleep, the deepest stages of sleep, you can't get that with sleep apnea. You often get knocked out of many of these deeper stages of sleep. And now your brain system, we like to call it the brain washing, perhaps better it would be the brain power washing system, is not able to function because you
Wow.
can't go into deep sleep. So
Wow.
if you have this condition, sleep apnea, and you have all this fragmentation, you don't go into deep sleep, no wonder you feel awful the next day. And it's very important to think about this system in terms of mental health. Because, mental health is not just something like, well, I am depressed. It's no, it's I'm also irritable. I'm also tired. I'm also overly reactive. I'm also angry. And when you start thinking about all these different clusters or constellations of symptoms, when these clusters appear, the mental health community has to start realizing, well, this isn't just depression. This isn't just PTSD. This is somebody who's not sleeping well. And we've got to figure out why they're not sleeping well. We've got to put it together. We've got to diagnose it, and we've got a treatment. And so now the major point here is to realize that sleep is always always about the mind and the body. You've got psychological parts of sleep, you've got physiological parts of sleep. And as long as you look at both pathways, you're going to be in great shape to solve your sleep problems.
Yeah, you know what's it's funny. Also, I think one time during a summer when I was a freshman in high school, my buddy, he was a short little guy, right? I mean, not I wouldn't say short, but shorter than us. We came back to school our sophomore year. He was way taller than all of us, and we were like, "Dude, what happened?" He's like, "I slept the whole summer." And it's funny. I see this with even my teenagers. They want to. You could tell they're getting a little more sleepier during the summer times when it seems like their bodies do want to grow. I think that it's a lot of studies been shown that that's why they even induce comas and stuff like that when people get injured and things
Mhm.
like that, because your body is able to it repair itself at that form, right? I
Yeah,
mean,
with good sleep, with good deep sleep, you actually produce growth hormone, which is a very important, hormone that is going to be helping with, like you're talking about, reconstituting the system, regenerating tissues, even helping with things like metabolic syndrome, helping the way your body manages glucose and insulin sensitivity versus insulin resistance. So, all kinds of good things happen metabolically when you sleep well. However, again, going back to this main point about how do people think about it, one of the hardest components of getting this information out there is that most people just don't believe it. It doesn't
right.
matter what we're talking about right here, right now. Somebody can hear it, they can listen, it sounds very interesting. But unless it's happening to you and you actually go through some trial of treatment, like you have a good response to CPAP, or you get cognitive behavioral therapy for insomnia, and you turn things around, well, then suddenly you start waking up and saying, wait a second, I used to feel awful all the time. Now I'm feeling so much better. I mean, was it really all about my sleep? Like, gee, how could my sleep have been that important when everybody always says that sleep is for sissies? And I thought they were right. And I thought I should just learn to get by and have another Red Bull. So this is kind of like, you know, the mainstream media, journalism today, they totally are at a loss to understand sleep. Still to this day, they
Well, I
just don't
think
get it.
I think I'm probably gonna piss some people off with this, but be like big pharma. I think big pharma doesn't want it to be that easy, right? They don't want people to realize that, oh, you just need good rest and good sleep at night and you can be a healthier person in life. I mean, because a lot of people, they try to run on caffeine and try to uh
Right.
induce a lot of sugars and stuff that literally are killing them. And instead of getting that adequate amount of sleep and rest and the time to kind of switch things off, because I think that's another thing as human beings is while we're awake, some of us, especially nowadays with these reels that people just like go through like 6 seconds and they're on to the next thing, processing all these different reels and information time and time and time again so fast, right? Like I feel like during the day, some people now are putting so many different inputs in their face, they're not getting much output out of it.
Right. Right.
Right? Um,
Yeah, I mean, I think the big pharma thing has a mixed picture. On the one hand, big pharma, produces some major, major milestones in pharmacology that have saved millions of lives. But in the
sure.
field of sleep medicine, they have really had a very narrow perspective, which is peculiar for pharmacology because where the action is trying to learn more about how does breathing affect sleep. Instead, they're all caught up in these neurotransmitter uh, um, sort of pathways. I'm not saying they shouldn't be looking at it. I'm not saying they aren't interesting. And I'm not saying they can't produce some results, but the record is not very good for sleeping pills. I mean, most people who use sleeping pills eventually stop using them. Some people, unfortunately, get addicted to them or dependent on them. And those people often say the pill isn't even working, but they're still using it. There are people, of course, who get a good response, and that's wonderful. I'm happy for anybody who's using Ambien or Remeron and they're getting a great response. That's a terrific thing. But that is not typical. Absolutely not. Most people quit these drugs. Most people get some kind of side effect and quit, or they stay with it. And because nobody said to them, oh, by the way, there's a whole lot better treatment out there called cognitive behavioral therapy for insomnia or treat your sleep apnea, whatever it happens to be. They just don't hear. They're never sent to sleep doctors. They used to go to primary care doctor, a psychologist, a psychiatrist. That's the end of the story. Nobody said, well, did you know there's something called sleep medicine? And then, you know what they think that is, right? That's a mattress company.
No, the thing I've learned from having a couple doctors on here now, and one of the doctors I had on was more on the nutritional side of life, right? Like treating things, naturally, and giving yourself the right supplements in your body, things like that. He said a lot of our medical field is literally just to try to keep people alive, right? They're not necessarily fixing the problem. Like with diabetes, we
Right.
throw insulin at them. We, you know, things of that nature. We don't necessarily get down and fix diabetes and get rid of diabetes.
Mhm.
We're just like, well, here we'll manage diabetes, and
Right.
that's the problem is, because in the medical field, they're not going to have their job if a whole bunch of people aren't become a whole bunch dependent upon insulin, and they need these insulins. And so now they're making money off of people needing insulin versus, hey, let's get these people the help so they don't need insulin anymore and we don't have that problem. Oh, well, wait a second, then we won't have any patients, you know?
Well, health is an incredibly complex field. And the biggest problem, believe it or not, is largely the patient. Because
Yeah, true that.
even if the doctors are ignorant, the patients have no excuse.
Sure.
If you want to be healthy, we have the internet now. We have an enormous body of information people can research, they
Yep.
can learn about. And I'm not suggesting that everybody, needs to get off their insulin by any stretch, because
No, right.
these things are very complex. Some people need much more sophisticated treatments. They need medications. They do need insulin. But
Sure.
the point is, what could they do about their exercise habits? What
Yeah.
could they do about their diet? What could they do about their sleep? The problem in the Western civilization, and it's particularly so in America, is that we have really grown soft when it comes to health. And we've gone down this paradigm where people believe that, well, I guess somebody else will take care of me, meaning the doctor. Okay, well, that's fine. When you have certain diseases that are diagnosed and certain conditions, doctors are fantastic. If you find the right doctor, they give you the right diagnosis and they give you the right treatment. But as you're pointing out, what about all the steps before that? Can you imagine what it would be like if all of these people that have been traumatized and like they go on for years with their PTSD symptoms, and some of them get therapy, some of them get medication, some of them get nothing? What if all of them were told, well, you're showing some signs of post traumatic stress. You've got some nightmares, you've got some insomnia, you've got some irritability, you've got some fatigue. Um, we want to test your sleep, and we want to get you involved in a sleep re-education program. Well, I guarantee you, if you did that, you would drop the rate of actually diagnosed PTSD probably as much as half, just by aggressively working with their sleep problems soon after they return, from combat, or, whenever the timing is such that these symptoms present themselves. And, many people do present with nightmares and insomnia as the first two indicators of difficulties following, military service or even while still in the military. And once you hear about insomnia and nightmares, a red flag goes up and they're thinking, well, we probably need to screen you for post-traumatic stress because insomnia and nightmares are two common symptoms of post-traumatic stress. But right at that point, as soon as you have that information, say, okay, well, let's look at your insomnia problem. Let's look at your nightmare problem. Let's get a simple sleep test. Let's find out everything about your physical and mental sleep problems. Let's treat them aggressively and let's see what happens. I guarantee that the rate of PTSD would drop dramatically because these people would start sleeping better. And when you start sleeping better, you start healing yourself in ways you can't unless you do treat your sleep problems. And that's one of the reasons I'll say it loud and clear. So many people are on these PTSD medicines, these cocktails of
Mhm.
numerous drugs. They're not getting better. This was what was called to our attention in the early to mid 2000s. All of these reports about the young military, um, active duty, or veterans suicides, just so many suicides. And if you read the headlines, the story was always the same. I've written about this in two different books. What's the story? Oh, the patient came in who's having trouble with sleeping. The person came in having trouble with nightmares. Oh, so the doctor doubled their dose of Seroquel. Oh, so they came back a couple months later. Okay, so they tripled the dose of Seroquel.
Mm.
And the story goes on and on like this. Never does the story say, and the patient was referred to a sleep center. Never,
Mm.
not once. The story always ends, the patient committed suicide. And I'm going crazy. Like, it's right there. It's right in front of you. All of this is sleep related. Why didn't these people get referred to a sleep doctor? Why didn't they get treatment for nightmares? Why didn't they get treatment for insomnia? Why did you keep pushing pills on these individuals? So, this is what really put the bee under our bonnet when we realized that we had so much information that could help these individuals, and yet it's just not getting disseminated out there, even to this
Now,
day.
right now, do you what do you think that is from? I mean, do you feel that it's still such, no one really wants to touch that, you know, it's still very new to a lot of people. They're not educated there. What do you think is that the factor that keeps people from allowing that to go down? I mean,
Yeah.
it
Yes, and
sounds very sounds like it makes sense to me.
well, the issue of making sense and what happens in the
Right.
real
Yeah, no,
world
I get
nowadays,
that.
those
I
those
am from the
2,
Marine Corps,
yeah,
so I get a
yeah,
lot
those
of
2
that.
those 2
Uh,
don't go along too well. I mean, I've written a couple books. One was Sound Sleep, Sound Mind. I published 15 years ago. The new book, Life Saving Sleep, was published just last year. And, um, you'd like to think that these books will make a difference, and they will, on an individual basis. But you're raising a very, very important societal question. And there are several factors that really have to be brought up. One is we can't escape the fact that people absolutely disrespect sleep. But we got to be fair. There's a reason people disrespect sleep. Nobody really knows what they're doing while they're sleeping because they're
sure.
sleeping. They can
Yeah.
wake up a lot and say, well, I wake up a lot, but so what? I don't know what that means. Doesn't everybody wake up? I love the fact that people think that it's normal to get up at night and use the bathroom to pee. They think that that's normal. I'm going to come back to that story because
Uh-oh.
it's a fascinating component of how you really understand what normal sleep is. So you have all these people don't know what sleep means, don't know how to really respect it, don't know how to put it together. And then who else doesn't know it that is supposed to be telling them? Their primary care doctor, their psychiatrist, their psychologist, their mental health therapist, their counselors, um, pediatricians are not telling the parents, about the children. Although pediatricians actually do a little bit better job because parents do complain about the kids that don't sleep, and pediatricians seem to learn a bit more. But as far as adults go, if you look at the broad spectrum of health, doctors are not in there asking really key questions. They may say, well, how do you sleep? Okay, fine. Thank you very much. Okay. What was your blood sugar? Okay, what's your blood pressure? Sleep is a vital sign. They should be digging in with 5 to 10 questions every visit. Let me dig deep to find out what is going on with your sleep, because it's not that hard to figure out if somebody needs a sleep study or not. So that's the next thing. So that's the whole healthcare profession. And then the last part of it is society at large has its own conflicts with sleep. When you think of sleep in the workplace environment, the first thing you think of, if you're mainstream, if you've got like a certain community of 20 workers, 500 workers, 1,000 workers, is who's lazy, who's sleeping on the job, who needs to take a nap, what's wrong with them. So that doesn't say, oh, wait, that guy's taking a nap. He could be unsafe working in my, my business. I ought to get him a sleep test and find out if I can turn him into a better worker. No, he just gets fired. And then he goes on to the next job and does the same thing. So you have this business culture, this societal culture that doesn't understand sleep, which then further adds disrespect to it. So all of these factors are aligned. And the final one is what you mentioned earlier. It has to do with pharmacology, but not so much pharmacology with like prescription drugs. What happens when you go in a drugstore? Whole big wall, all of these things, over the counter medicines for sleep. Why? Because people have sleep problems and they want a quick fix. And so somebody said, gosh, I can make some money. People want a quick fix. I'll put Benadryl in a pill. I'll call it something different and they'll use it. And, for some people, again, it works. So these are the big factors that you've pointed, that you're asking about. And until all of them are looked at, it's going to be very difficult to get people involved. And that's why I always think in terms of, the lowest hanging fruit is the person who's suffering. And when that person suffers enough and recognizes the doctors and therapists are not helping them, hopefully they'll buy a book like mine, Life Saving Sleep, or they'll buy somebody else's book, or they'll go on the web and they'll find something. And they'll start reading and they'll go, you know what? This sleep thing is a really big deal. And it looks like nobody else out there is talking to me about it. I guess I'm going to have to do my own research. And that's not a bad thing. And the more that happens like that, the better off we're going to be.
Absolutely. Yeah, I mean, I know that a large portion of people, that especially come out of the military, there's a lot of sleep deprivation in there, having to do or get even interrupted sleep, because you got duty, you got to do fire watch, things like
Right.
that. I remember, there's nothing like going to sleep for maybe 2 to 3 hours and then getting woke up and feeling horrible. I mean, there's times, and there's been times I've slept an hour and I feel amazing, but I could tell you, there's times where I just like, oh gosh, I got to do fire watch. Damn, and it's rough. And then you got to get up and perform the next day and get ready to go. There's a lot of pushing yourself. And
Let
I
me give
think
you
that
a let, let
that
me give
starts to
you a
create a pattern for us too. We started
oh,
imprinting
absolutely.
ourselves
Right.
around that age of 18 to 22 years old, which,
Right.
we're still very impressionable in our brain, I feel like.
Well, let's talk about that pattern in the context of the military in particular, because the military has a certain culture that evolved for a very natural, organic, and relatively speaking, healthy process having to do with the way sleep was looked at. And that is the following: years ago, people were much better sleepers. If you go back 100 years or 50 years, whatever the number is, there's been a lot of changes over the decades. But if you go back to, say, World War II, you probably had much better sleepers at that time for a lot of different reasons. We don't have to go into all the reasons, but there's a good evidence to suggest better sleepers. That means if you're a better sleeper, a normal sleeper, you do have a different capacity. You do have an ability to get by on 4 hours sometimes. And you get up and say, well, I got to get my work done. Maybe I'll have a cup of coffee. But that person, because those 4 hours were so solid and such perfect sleep,
Like the
that
deep
individual,
sleep. Yeah.
right. And that's what you see today, for example, in people who go into surgery residency programs. It's like a self-selection. People who become surgeons usually are very good sleepers, very healthy sleepers. And so they can get by. So in the military, the norm, the standard was you could make jokes about the guy who needed more sleep because he wasn't normal. He wasn't typical. I'm not saying that all of them weren't complaining of sleep deprivation. I'm sure they were, but their capacity to function, to get by, was far greater than it would be in the military today. Because I'm betting if you look at the body mass index, you look at the health indexes, you look at a variety of things of who's in the military today, you may discover things that they're just not as healthy and physically fit as those people were 70, 80 years ago. I don't have all the science on that, all the evidence. I'm just saying it's a theory
Oh,
that's been proposed by many people
it, I,
because it's clear something is getting worse.
I think it's our food, right? Processed food. I
Right,
think, you bring up a good point. Back a long time ago, there was farmers, a lot more farmers that grew their own food, or they grew it for the community around them, right? And so it wasn't coming from way over from across the states, or and having to be processed and set.
right,
I mean, a
right,
lot of that's the thing. I think our diet has changed
right.
tremendously from back in the day. So I think that probably plays a lot of a factor into you know diabetes, health, sleep.
Sure, sure.
All the certain
Fitness.
things that we've definitely have changed and are
Right,
way more of an unhealthy society than they were a long time ago,
right.
which
And
is
so
kind
the
of
military,
alarming.
right. So now the military, because it still has to recruit from the population, I mean, it has to work really hard to find the best of the best. Those people may not even want to go in the military, but if they find them, those might be the normal sleepers, but that's not going to be their large majority anymore. They're going to
Right.
be getting many people in the military who are coming in, by the way, with sleep apnea. And they don't even test them because they're young and they figure, well, they passed this physical fitness test and their blood pressure is okay. So we're going to bring them in and we're going to make them more fit with boot camp, which is great. But they don't realize they're still working with an individual who's got something going on in their upper airway that's probably going to compromise their capabilities down the road. And I've told people in military institutions that I've consulted for over the years, saying, if you really want to nip this in the bud, you're going to have to do a lot more evaluation of sleep before you bring somebody in the military, and you're going to have to make a commitment to helping them with what you find, so when you do bring them in, you get your money's worth, because they're not lagging behind, because they suffer from these awful sleep disorders that are just totally malfunctioning their brain.
So let me ask you now. I guess they've always said, I think I've heard 8 hours is a good amount of sleep. Now, would you say that varies based on how the quality of that 8 hours is? Like someone like you said that gets 4 hours of quality sleep, you know, eh, but someone that gets 8 hours and they're tossing and turning kind of through all those 8 hours. Now, does it matter the amount of sleep you're getting, or is it the quality of what you're getting, or both?
Right, perfect question. uh, my whole book, Life Saving Sleep, is about sleep quality. Sleep quality is what determines pretty much everything about your sleep. In other words, even if you're an insomniac and you think you're not getting enough sleep, the chances are very high there's something physiologically going on that's messing with the quality of your sleep. In younger people, it's harder for them to appreciate this, But as you get older, it becomes more and more obvious that you, for example, keep waking up at night over and over again. And people keep thinking like, well, why is I'm getting older? Why do I keep waking up? Like, what's happening? Well, you were asleep before you woke up. So how are you supposed to know? You can't know. And this is a big problem. You have to get a sleep test to actually figure that out. But here's a clue, as I mentioned earlier. Most people, if they walk into a doctor's office and they mention, Doc, I wake up once a night to pee. And the doctor looks at him and says, well, I mean, you're 45. What's the big deal? You could wake up once or twice. Well, don't you think I should go to a urologist? You go, okay, I'll send you to the urologist. So you go to the urologist. I'm waking up once or twice per night to pee. Okay, well, what's wrong then? Well, do I have a prostate problem? Okay, well, we can check that. That's pretty easy. Do I have a bladder problem? We can do some tests on that. Okay, well, why did I wake up to pee? You just said you did my tests. They're all normal. Well, you're just getting older. That's all. When people get older, they just wake up at night to pee. Seriously. Okay. So let me ask you this. If I wave a magic wand over you and I give you this special treatment that makes your sleep better, and all of a sudden, you no longer wake up at night to pee, zero, not one trip to the bathroom, are you still going to tell me that it's normal to wake up once or twice a night to pee? And the evidence that I'm describing for you right now is over 30 years old, published in the scientific literature showing that sleep apnea causes your kidneys to work overtime, produce more water, pass more water into the bladder. You wake up and you
Mm,
pee. You treat the sleep apnea.
that's
You stop going to the bathroom at night. Now, think about that. There's millions. You're talking about millions, tens of millions of people that go to sleep, they wake up, they pee, they think it's normal, they don't
yeah.
care. Some of them just go back to sleep.
Yep.
Some of them have insomnia. The bottom line is this is actually affecting your heart. This is pressure being applied to the right atrium of your heart, which
Mm,
releases its own diuretic called atrial natriuretic peptide into your bloodstream, goes to the kidneys. Kidneys pass more water into the bladder. You wake up and pee, and you think that's normal because all these doctors are telling you, well, you're getting older. You wake up to pee.
yeah. Oh man, that's interesting because yeah, I gotta say, is a lot of what you're saying resonates with me, unfortunately. So
There's a
I'm that
um,
sleep
uh,
apnea is probably for real for me because I told you before, I tried the sleep apnea test and the ding alarm just beep beep, and I was like, oh, I'm done. And then they're like, it's inconclusive. Well, I guess I have sleep apnea,
right.
you know.
But by the way, on my website, barrycrakowmd.com, there is a 5-minute video that describes what I just said. It actually shows the whole thing. I'm doing it on a whiteboard at the time. It's a much younger, better looking version of me doing this on a whiteboard, describing to a group of occupational health nurses about this process, about how is it that sleep apnea would actually cause this difficulty while you are sleeping. And the answer is that the sleep apnea is affecting your heart. Your heart then has to release this diuretic. There's a section up there called talks. If you click on that one that says talks, you see topic number 1 on the left. That's the one that has that story. And there's
Uh-huh.
another one over there on the right that talks all about nasal hygiene, how to get your nasal breathing better, because that's the very first step for anybody who wants to improve their sleep apnea, working on their nose.
Wow, that's amazing. I definitely gonna have to watch it. How long is this one over here on the left side?
That's 5 minutes.
All right, let's take a we'll take a look at it. We go see full screen. I'm not hearing the sound there.
Raise your hand if you understand why sleep apnea patients wake up at night to use the bathroom. So you've got an obstruction in your airway. Okay, we'll just signal it like that. Something is going on, can't get the air in the way you would expect. Well, in your chest cavity, you have a bunch of blood vessels. In particular, you have like the inferior vena cava, and it's trying to move blood back into the heart. Well, this chest cavity has a pressure. If you were choking right now, and you tried to breathe in, but no air was coming, what do you think happens to the pressure in the chest cavity?
Increases?
Increases, right. Now, technically, it has a weird convention in pulmonary medicine. It says increasingly negative intrathoracic pressure, okay? So that's what that is, and it amounts to, and you can feel it, right? You feel that in your chest wall. That increased pressure pushes on the venous system, and it pushes blood more rapidly back into the heart. All right? Now, if this is a heart muscle cell in the right atrium where this blood is coming back, what does this cell look like several hours later when it's been doing this all night long? Because this is happening all night. This is not just like one apnea. This is a sequence of you're struggling to breathe all night long. This heart muscle cell is going to look like this, meaning what? It has become distended because it's received either a faster or larger volume of blood than it's used to receiving under the so-called circumstances of normal breathing. Okay? So if it is distended, the heart has various sensors that have to monitor whether or not there is something called fluid overload. And the heart has built-in sensors that does not want to have fluid overload because that's a danger to the heart. This, in fact, is what's called a false fluid overload signal. And it's false, of course, because there was no increase of fluid into the body. It's just rapidly sending the fluid to the heart. So the same amount of fluid is in the body, but it's going to the heart so fast, the right atrium distends. The right atrium thinks, I must have a fluid overloaded state here. I better do something about it. So what does it do? It releases into the body a peptide known as ANP. And ANP comes from the atrium, so it's called atrial natriuretic peptide. And of course, you got the hint here. This peptide is a diuretic. It's the body's own diuretic. It goes to the kidneys. The kidneys make more fluid, urine output, into the bladder. Depending upon your own sensitivities, prostate problems, bladder problems, age, and so forth, even the amount of water you might drink at night, at bedtime, your bladder will hold so much. And once it goes beyond a certain threshold, you're likely to wake up and use the bathroom in the middle of the night. I also believe, although this is an earlier theory that people say has been disproven, but I still think there's a relevance to it. I believe this pressure also does something to descend down into the pelvic region and actually create more pressure on the bladder. That used to be one of the original theories as to why people wake up at night to urinate. I still think there's some validity to that, but I don't know how you prove that. This is the one that's the most common pathophysiological mechanism that has been described. So what do? Reverse all this, put somebody on PAP therapy. You reverse the whole cycle. There's no buildup in pressure, no increased venous return, no distension of the right atrium, no false fluid overload signal, no release of ANP to the kidneys, no increase in urinary output. You put people on PAP therapy, between 50 and 80% of the people no longer get up at night to urinate, just completely eliminated. And the part that's so interesting about that is that if you look at urology journals, when they're talking about this problem of nocturia, they are talking about the concept of reduction. They're talking about reduction of events In the sleep literature, you can talk about the elimination of events. So you've had a surgical procedure or you've taken a certain pill. You'll read about it in a urology journal, and there's now this reduction in the number of times that you go to the bathroom. But in the sleep journals, you will hear them say something like, and 50% of the people no longer went to the bathroom. So it's a pretty remarkable, pathophysiology.
Wow.
I hadn't watched that all the way through in a few years. Wasn't that guy much younger and better looking?
Dang, man. Sheesh. That was, you know what? Very informative, though. And it makes a lot of sense. And I think, for me, definitely making me think, wow, my sleep apnea is probably off the chain now, because.
Let's talk about this, because this is a key point about the fact that when you mix the words PTSD and sleep apnea, there's a key element that must come to the forefront right away if you want success. And that's that PTSD is under the category of an anxiety disorder. And that means you have to ask the singular question, can somebody with anxiety learn to use CPAP? And the answer to that question that we learned 20 years ago and have published on repeatedly is no. Somebody with anxiety should not be given CPAP, but instead should be given a device known as bilevel, which is a different type of PAP therapy that produces a much easier capacity to adapt. And so most people who would start on bilevel and not CPAP would be able to learn how to use a PAP machine. And let me be very clear what I mean by this so you understand the framework that we learned about this. If you put a PTSD patient with known anxiety, nightmares, maybe some trouble with claustrophobia, maybe a history of panic attacks, and you want to put them on CPAP, that C stands for continuous airflow. So when you're breathing in, it could feel pretty good. But when you're breathing out, that air is still coming in. That can produce a smothering sensation. The person can rip it off. The person can have claustrophobia, panic attacks. And you can imagine if somebody with PTSD was given CPAP and said, go home and use this and get back to me in 3 months. Well, a week later, it's already in the closet, or it's on the
100%.
floor.
Yeah.
Right. And so you're going, well, what did that do? Well, you know what that did? That re-traumatized the individual. You have now made their relationship between sleep and sleep apnea and CPAP one of, I'm never going to do that. That's ridiculous. But these guys are trying to torture me. In fact, it does come close to medical malpractice because a doctor is supposed to not do harm. They're supposed to know if they're giving somebody something that's going to make things worse.
Right.
So we learned all about this in 2005, and we stopped using CPAP. We learned ways to work with the insurance companies so that it was totally clear that we would evaluate the person's limited exposure to CPAP and confirm that that was not the right tool for them, and we're going to switch you now to bilevel. So when our patients went home and got a prescription, 99% of them got a prescription for a bilevel type device. And we published papers showing that we could get over or about 90% of PTSD patients with first-time diagnosis of sleep apnea to actually fill a prescription and use a bilevel machine. Now, that's not saying they're all using it all night long like they should, but like 60% of them were, and the other 20 or 30% were still using it partially. So you're talking about a major difference compared to what's in the PTSD literature about the use of CPAP. 90%, 9 out of 10 would use bilevel. The literature on CPAP and PTSD is abysmal. I mean, rates are sometimes as low as 1 out of 3 or worse.
So can you explain kind of the difference between the bilevel and the actual CPAP?
Well, remember that concept of breathing out against air coming in. So bilevel drops the airflow. When you breathe in, it still feels good. Any person, pretty much any person in the world, could take a CPAP mask, a CPAP machine, any type of mask, hold it up to the face, breathe in, and then pull the mask away, and then breathe out. Of course, that would never work to treat sleep apnea, but pretty much anybody could do that because it actually feels kind of good to get all that airflow coming in. But when you try to breathe out, if the air is still strong, it is anxiety producing.
Yeah,
I
no
went through
shit.
this.
That makes
I,
100%
yeah,
sense to
I went
me.
through. I went through this when I tried to learn how to use CPAP, and then eventually I, had to go on bilevel too. So bilevel, let's say the pressure on CPAP was 14. Well, bilevel will give you the 14 when you breathe in, but then it'll drop it down to 8, which is 6 points lower than 14. And the individual, what do they say when this goes, this experience goes down? They go, "Gosh, this is pretty comfortable. I think I could get used to this. How come they didn't give me this the first time I tried this?" And I said, "Go figure. I have no idea why they didn't give this to you." So we work with thousands of CPAP failure cases,
Wow.
people who had been, given this treatment, they couldn't use it. Some people toughed it out and were still using it and getting a horrible response. And so we've
It's a
learned, and
shame. It's a shame because I know even my father used it and he told me, it was difficult, because uh, because of that constant just, and then the machines are kind of loud, right? I'm sure they've gotten better, but that's the other thing. And then you're kind of hooked up to something, so I feel like if you're moving around, or man, that just be
right. So if you take all of the parameters, there's no question like the tube, the mask, some people need a chin strap. Um, some people need, special humidification. Some people use earplugs. Some people wear eye masks. The list goes on and on of the things you can do. But here's where the rubber meets the road. Your breathing is the most primal experience that you can consciously be aware of. Like you have a little bit of awareness of your heart, but your breathing, it's right there. You're doing it all the time. You can always be aware of it if you want to be. You can even control it a little bit by choosing to run, choosing to walk, choosing to lie down, saying, I want to breathe this way, I want to breathe that way. So you have all this awareness of it. Well, you know where you have the most awareness of it is if you don't have any breath. If you lose
right.
your
Yeah,
breath, you're not going to like it. It's
no,
it's it's not, zero oxygen is not a good thing. So over the time with this sleep breathing disorder, you're actually suffering hundreds of mini suffocations during the night. We talked before about the sleep fragmentation. You're waking up a lot. But why are you waking up? Because you can't breathe. And these are called mini suffocations. Now, why is this important? Because that's the whole feeling that's going on in your mind subconsciously about why you wouldn't even want to sleep. Why
yeah.
would you want to go to sleep
You had
if
to
you know
get
this
that done,
if it's going to happen to you? That's why
right?
so many people have insomnia and have sleep apnea together. So what I'm getting at is, and this is a hard concept to understand at first. It's kind of like the magic wand experiment. When somebody gets on a breathing device that's comfortable for them, what's going to start to happen is they're going to start to relax and realize, oh, so I'm not going to have a mini suffocation tonight. In fact, I'm going to have clear breathing all night long. The next thing you know, they adapt. And it doesn't matter what you do, then you could never take that machine away from them
Right now they
because
need it. Yeah.
not just that they need it, they
Well, they
love it.
want
They
it. Yeah.
love the feeling of being able to breathe in a healthy manner. And
Right.
see, now that particular point in the journey makes everything else pale in comparison. They go, okay, well, I'll fix my mask. Okay, well, I'll fix my chin strap. Whatever it is, I'll fix it. Why? Because it is so fundamental that you've been able to fix this breathing problem, and you're no longer choking thousands or hundreds of times a week because you have this sleep breathing problem. You, in fact, have cured the problem every time you use the treatment.
It makes a lot of sense because I'll tell you, when I went to go do that sleep apnea test, I feel like it kicked in the thought and the PTSD, and every time I fell asleep, like I said, I stopped breathing, and I don't think I never had such interrupted sleep like that before until I brought the machine to do the test, and I think it was because I physically knew that machine is sitting there now, getting ready to do my thing, and I think it got in my head because, I mean, honestly, when
Well,
I
did
went
they
to do
not?
the
Did they give you a diagnosis?
no, because they said it was inconclusive because I didn't uh, keep it on long enough for it to go. Because I mean, I'm saying within the first 2 hours, it was literally every 10 minutes I would nod off, and I was like, I can't sleep, and I got to go to work. And it's like
Hmm.
I'm doing this test, and they probably gave it to me on the wrong. Like they shouldn't have given it to me on a day that I needed to go to work the next day. I probably because I was in my head with it. I think even more because I knew that I've probably had sleep apnea issues, but when I brought the test, it made it like literally every 10
Right.
minutes, and
Right.
I felt myself stop breathing.
Are they going to give you a chance to try a machine?
I mean, I probably need to go. It's been years, and it's been years.
I
I'm
see.
gonna.
I see.
It's
Mhm.
been years for myself, and I probably need to go. I want to look into this bi-level thing, and I would love to actually try that first, and especially since you touch on the PTSD thing being kind of a trigger. I could see that being for me. I have issues that I never knew that I had of being claustrophobic and stuff like that. By
Mhm.
then, the VA was trying to get me into this machine. I went into it not knowing I had claustrophobic problems until they got me in the tube, and I was I pushed the eject button
Right.
immediately. Like
Right. Right.
before I start doing the funky chicken dance in this thing,
Uh,
get me out.
right.
Yeah.
Right. Right. Right.
Uh,
So let me mention that in the book Life Saving Sleep, there's a whole section on how you work with sleep doctors and sleep centers so you'll get them to prescribe you a bi-level device. So that's
hmm,
one thing that's important because you want to know that they're so entrenched with this idea of talking about CPAP, CPAP, CPAP. You sometimes have to break down their own resistance to go, no, look, I have anxiety, I have claustrophobia. I don't really even want to start with CPAP. I want to try bi-level. And if you get in a tough tough spot, you go, okay, well, you bring out the CPAP and you bring out the bi-level. Let me try them right here. Let me see. Let me see the difference. And you go, look, I've just tried both of them. And I'm telling you, I can feel why this is so uncomfortable. I don't want it. I can feel why this is more comfortable. I would like to try this. And you see what happens. But even before you do all of that, one of the things I want to recommend is what we call nasal breathing treatments. It's called early conservative treatment steps. And that's a whole section or two in the book because if you work on your nose, you can actually start sleeping better tonight. Just by working on nasal breathing, you have a chance to actually improve your sleep immediately and
wow.
certainly over a couple of weeks' time. And then the payoff is that if you do work on your nose, then when you actually move on to the PAP machine, your response to PAP is going to be so much better and clearer because you don't have a nasal problem that you're dealing with.
Wow. Yeah. A lot of people, too, I don't think they realize they have like a deviated septum too. Sometimes I've heard of that
Yeah.
um, being an issue with a
Congestion.
lot of
Yeah.
people, and or
Deviated septum.
allergies and
Absolutely.
all those kind
On
of
my,
factors.
on my website, you were looking at the talks. One of them is called The Nose, Nose, KNOWS. And the nose is a 60-minute program. It's free, and it talks all about nasal hygiene and how you can get started improving your sleep breathing.
Wow, that's interesting. So that's awesome. Well, Dr. Barry, is there any other things you'd like to cover before we head out?
I think we had a great discussion, and I think we've hit a lot of high points. We can hope and pray that more people become more aware of the importance of sleep and mental health. People who get my book, Life Saving Sleep, will clearly get a big dose of what we're talking about. But for those out there, with their friends and family or themselves, it's very important to evaluate your sleep issues if you're suffering from mental health problems.
Absolutely. Well, I appreciate you coming on and just talking about all this. It's a lot of it kind of rang true with me too, and I probably need to go get myself looked at here. And I definitely wrote down the bi-level thing, and I appreciate you actually sending me a copy of the book too. I'm definitely going to be checking it out because I think it could benefit myself in a lot of ways, and I'm sure there's a lot of people out there listening that are kind of going through the same thing, because I, I I recently started getting up and going pee a little bit more than I normally did, and I'm like, oh, all right, you just I'm drinking a lot of water all day, I just those kind of things ring through my head, and now that you're saying what you're saying, it starts like ringing true. I'm like, oh boy, better probably have to go see the damn doctor here soon.
Right.
But I appreciate you for what you're doing and all the efforts and educating that you're doing. It's definitely going to help some people out there.
It was a great discussion. Thank you, Brian.
All right, well, thank you, and you have an amazing day, an amazing week, and I'll keep in touch with you.
Take care. Thanks again.
Thank you, doctor. All right, friends and fam. Well, that's going to go ahead and wrap up another amazing interview. Hope you guys have an amazing day out there. If you guys haven't had the chance to go check out the website, please go check it out, edasusmcvet.com. That's where you'll be able to check all the most recent interviews, all the old interviews, all the episodes we've done. We're approaching interview 85. It's getting kind of crazy. We're getting up there, almost 100. Anyways, hope you guys have an amazing day out there. Don't let the day kick your ass. Make sure you're out there kicking it. Until next time, we'll see you guys.